done by Grameen Koota. Next slide, please. Okay, so yeah. So we've not gone out of Karnataka for a long time because we always felt we had to get our backend systems right. Backend systems in the sense we needed to get a robust program. We needed to look at all the legalities, and then we needed to convince the microfinance institution also that we are service oriented and we are not here just for a year or 2 years for the program. We want to build a program that goes on and takes care of itself and that is self-sustaining. So then we got shot in the arm when the World Bank recognized us and asked us to implement the same program in Assam as well. So there we tied up with RGBN and started the program in about 8 districts of Assam. So this has been our scale so far. So and we are still trying to reach out to all the branches of Karnataka and then maybe branch out to the other states of India as well. Next slide, please. Okay, so technology has been a major concern for us. Initially, when we started, all the processing used to happen by fax and telephone and all that. Now we've built a backend software system which takes care of the registrations. So the registrations are done in the branch itself. Because I remember I and Anshul have had many discussions about Anshul not wanting his clients to actually spend too much time on the registration of the members and things because all of them are already overloaded. They already have a definite job to do, and asking them to do something beyond of that would be asking for too much. So then we kind of sat down together and said, okay, the registrations have to happen in the branch itself and it has to happen seamlessly. So there's no duplication of registrations, like somebody writes down a registration form and comes back and gives it to us and we fill it and things like that. So we built a software which is web-based, using which the staff of Grameen Koota are able to load in the messages, all the KYC details and all of that into the system itself at the branch level. So once that happens, all the data is collated here back in the head office, and at the end of the registration period, as Anshul mentioned, we have a specific registration period wherein we target a few branches. Within those 2 months, all of the KYC and all the details are logged on, and the patient is and the client is ready to get treatment at the hospitals right from the first day of the start of the cover. So we also built a mobile app wherein the Sakis who are there in the hospitals are able to send claims online to our head office, and our physicians here are able to approve of them. Also, if there is some patient who is waiting for a non-network claim, that is, if they have gone to a hospital which is not in the network and have taken treatment there and have submitted their claim to the head office, we have built a software, built an app using which these members can actually look at what stage the claim processing is at. So these are some of the features that we have built in the technology, in the software, because we said, okay, we can scale. Scaling is not going to be an issue because this is something that is needed by everybody. But we need to get our backend systems right first. So we worked a lot on this, and we were able to build this app and this software which takes care of most of the processing, which reduced the TAT time. Next one, please. So as I told you, the initial challenges were to convince the microfinancing institutions, convince the hospitals, and get the legalities right, and then to see that the turnaround time, the TAT that I was talking about, is fast and it is better than an actual insurance program. So we've been able to a large extent, get in all these things in place, and the turnaround time is completely, the claim processing happens immediately. The approvals for the claims that come through the hospitals happens immediately. Also at instances when accident case comes into a hospital and they are not able to send a claim because of excessive bleeding and things, we have given authority to the Sakis to actually take a call and get the patients admitted, so that the patient gets the treatment, and in the meantime they send us the approval and we do it from here. Also, as Anshul also mentioned, we have a package for each of the treatment, but there are instances where we understand that some cases cannot be treated in that package itself. Like for example, since the program is built by doctors, we know that a patient who comes in with a cholecystectomy might develop a septicemia during surgery. So he or she will actually require extended days of admission in the ICU. Generally, what happens in an insurance is every patient who goes in without an insurance card is given a bill for the treatment. But as soon as they produce an insurance card, the immediate cost goes up, and the hospital feels that they can bill the insurance company for how much are required. Here, the enhancement of the initial approval also happens from us. So we ensure that none of the members pay money out of the pocket in the hospital. So any enhancement that is required, the network hospitals have been given a format which they have to produce to us, and we enhance the amount online. Next slide, please. I'd like to finish by saying that the whole program is designed, and it started off being designed for the microfinance clients itself. And over a period of 6 or 7 years that we have evolved as of now, we've designed a program which we feel fits most of the criteria of a microfinancing institution. So saying that, I open it out for questions. Yeah.
Thank you very much, Dr. Arjun. Mukti.
Yeah, thank you. Thank you, Arjun and Anshul. This has been really enlightening. The way the partnership with SAS and Grameen Koota has spanned out. I think you spent a lot of time doing a lot of background work, putting your technology in place so that it would be easy to scale. There are a lot of questions that have come up, and I think it's going to be a very lively discussion. To start with, one of the questions is how different is your program from a health insurance program? So should I list all the questions, or can we ask one question, then you can give a response, and then we take the next question? Is that all right?
Yeah, we can take one question.
So how different is your program? You called it a mutual. It sounds like an insurance program. So how different is it from a regular insurance program?
So Anshul, can I take this? Or
yeah, sure. You take it.
Okay. So basically, ours is not an insurance at all. It is a hospital-run micro health mutual, where the hospital, Dr. M.D. Sachidanand Murthy Memorial Hospital and its branches. M.D. Sachidanand Murthy hospitals are 5 hospitals as of today, and we are scaling. We have networked with 40 hospitals for treatment of only our clients. And there is no claim approval, there is no insurance segment involved at all in the whole program. Here, the claims or the treatment to the members is processed by Grameen Koota and the hospital itself. The hospital has outsourced the process to SAS Poorna Arogya Healthcare Private Limited, which works on the similar lines of a TPA. But the difference between an insurance and our program, the major difference between the two is that we do not have anything like a rejection or a non-medical rejection and things like that. These are all clients who have registered into the program for a health mutual, which means that if a group of about 10 people have registered and they have paid membership fees for everybody, then the amount that is there for one person, that is 6,000 rupees, which is fixed for one person, can be increased up to 60,000. It is more like a family floater, but the whole difference is that it is a mutual wherein consensus is required from both the microfinancing institution and the hospital for the treatment, which is authenticated by the members of Grameen Koota.
So from what I understand is because the hospital is actually partnering with SAS, has contracted SAS to manage the claims. So if this is more like a HMO model?
Exactly.
All right. Now the next question is, so it is just not Sachidanand Murthy Memorial alone, but you have a whole lot of network of hospitals that may or may not belong to Sachidanand Murthy Memorial Trust. And so the next question is, here is like Grameen Koota is collecting the money towards what? Is it a health saving or is it a premium towards an insurance? Is it a regulated activity because does it sit with the financing or does it sit with insurance? Does it sit with the banking? Because mutuals, as mutuals in India, it has to be either cooperative. So where does this sit in the regulatory framework?
So basically, what we are doing here is that it is a program that is run by the hospital. So the Karnataka Private Medical Association, Medical Hospitals Association has issued a circular wherein they say that a hospital can collect fees directly from the clients or issue a health card related to the hospital using which they can get treatment in the hospital. So here in the mutual what happens is the membership fee that Grameen Koota collects is collected as a membership fee for the health mutual run by the hospital. So it is a program run by the hospital and its branches and also with other hospitals with whom they have had agreements with to service the clients. So it does not fall into the insurance regulatory framework. This is a mutual model which is run by the hospital per se. Like
okay, so correct me if I'm wrong. So basically, Grameen Koota is collecting the money on behalf of the hospital.
Yes, exactly.
Okay, so I'm going to leave that aside for the discussion right now because that falls into another realm altogether. We are focusing on health. That comes into the financial regulation stuff. So now coming back to this, some of the questions is, I think you have answered how different this is from the insurance scheme, and you have said that the enrollment is voluntary. So usually when a voluntary enrollment happens, there is a lot of people who are sick would enroll, not the people who are well. So you had said that out of 10 people, 6,000 rupees, and it becomes a floater of 60,000. If 8 out of 10 are people who are sick and already have a precondition, you don't have any exclusions. So if there is a precondition, then how do you manage? Because how do you avoid all of your group members who are voluntary are already coming in with an illness?
Yeah. So basically, as Anshul mentioned during his talk, that the registration period for each of the districts or each of the branch is actually limited to 2 months in a year. That is, if we are registering the districts of Mysore and Bangalore in April and May of 2017, the treatment starts from June. So it is only during April and May that the clients of these two branches can register into the program. Their treatment is round the clock. Similarly, if we go into Tumkur or other areas, the registration period is 2 more months, maybe in June and July, and the treatment starts from August. So the whole concept of anti-selection does not happen here because it is a fixed 2 months period during which all of the members have to register. And from our past experience, we have found that most of the clients who register into an insurance company register because they have ailments in the past 15 days or 1 month of taking the policy. None of the diseases are as chronic, like most of our conditions, most of our packages that we have are for admission for surgeries and other ailments like typhoid and malaria and all these things. So a person cannot have malaria sometime in August and say, okay, I want to register into the program because in Mysore, because his registration period has ended. So by taking care of this issue, by forming a frame network of 2 months or a period during which a branch or an area is targeted, we have to a large extent eliminated the risk of anti-selection. Also, from our experience in the past 6 years with Grameen Koota, we have found that we have never overshot the membership fee collected in terms of payments made for treatment.
Right. So what you have a 1 month, 1 to 2 months waiting period once a person enrolls, and the enrollment period also you're curtailing it for 2 months a year. So yeah, that's a smart thing to do because then you're curtailing the enrollment period itself. So therefore that would answer one of the questions by Sendal, which says, asked, how would you do this? Now, the next question which has come is, I guess you have already answered that, but still I would ask you this question because it has come up. How do you deal with high-cost treatments, chronic treatments, heart surgeries, neurosurgeries, as well as basically high-cost secondary and tertiary care? How do you manage that?
So most of the hospitals owned by Grameen, owned by Sachidanand Hospital and also the network hospitals are in rural areas where the need for the regular treatments is more than high-end surgeries. So we've not tied up with any of the multi-speciality hospitals or the super specialty hospitals which do complicated cardiac and neurosurgeries. But the patients have an option to go to any of the hospitals they want, other than the network as well, get treatment there and send us a bill amount for which we reimburse the cost depending upon the amount that is there in their membership card or depending upon the package that we have fixed for those conditions. Like for example, for a cardiac surgery like an angio, the package fixed might be about 50,000. The patient might go to an Apollo hospital and the treatment there might have costed them about 65,000. So they collect all the bills and send the bills via the GK head office to the hospital. This is processed and depending upon the eligibility, if there are more than 10 members in the family, they have total of 60,000 in their membership card. 50,000 rupees is released to the client. This is in terms of high-end surgeries.
So this is from condition to condition. It would vary and the call would be taken by Grameen, Koota and SAS at that point in time, depending on the pool that is available or depending on the condition.
Correct. Right.
Okay, so depending on the pool or the condition, right?
Yeah, that's right.
Okay, all right. I hope that answered one of the other questions. Now, the other question that has come up is how from Equitas, from Alex, is how do you integrate your program into the government health insurance, free health insurance scheme that's available in Karnataka?
So in Karnataka, Karnataka being the state with the highest number of government-run health programs, it is a good thing for us that the government has the RSBY, the Yashaswini and the Vajpayee Arogya operating in Karnataka, because we have always found that the patients who go to the hospitals with a RSBY card or a Yashaswini card or a Vajpayee Arogya card have to pay in excess of what has been prescribed by the government, simply because the program is good, but the packages that they have given for the surgeries is ridiculously low and the hospitals cannot operate out of those packages. Like for example, for an appendicectomy in a RSBY program, if a patient goes to a hospital, the cost for the hospital to perform an appendicectomy, including the medicines and all of this, would be around 10,000, I'm assuming. And the package that is announced by RSBY for appendicectomy is about 6,000. So the hospital will definitely not want to give away the 4,000 and lose 4,000 and operate on the patient. So they collect the difference amount from the client itself. Here, because our clients have already got the RSBY card and also have registered into our program, 6,000 is collected from the RSBY program and whatever difference amount is there is released from the mutual. So this way the patient doesn't have to pay anything for the surgeries if they have that card as well.
Okay, so basically the mutual, the pool that you have collected would go for the whatever are the incidents.
It is a supplementation to the program.
Supplementation to the Arogya program. Great. Now the next question is there any scope for enhancing in the near future the insured amount from the existing 6,000? Actually, you can't say insured amount from the amount that you'll be paying out from 6,000 rupees.
That is exactly based on the cost of the hospitalization and the cost of surgeries and also the paying capacity of the clients and things. With Grameen Koota, this is the fee that has been fixed is about 250 rupees, and for this about 6,000 is how much we can actually give them. Whereas in Assam, the fees that is collected is about 630 rupees, and a cover of about 10,000 rupees is given for each member. This is because in those regions, the cost of treatment in the hospital itself is high, and hence the packages are high. So this is a region-wise assessment that we do along with the microfinance institution that ties up with us.
Okay. Do you also pay for other incidentals, like, for example, loss of wages, transportation, or food? Because if it's a microfinance member or a poor person, when they go and get admitted into hospital, they really cannot afford to be giving up on their work. So do you also pay for that, or does the mutual only pay for the hospital expenditures?
See, with Grameen Koota, what happens is, through the program, through the health program, only the hospital expenses is paid out for. But Grameen Koota themselves, I think Anshul will explain this better. They have something called an emergency loan. Anshul, can you?
I'll talk about it. So, Grameen Koota, see, the program what we have is SAS is only covering the health expense. But Grameen Koota offers multiple products. We have an emergency loan, then we have a separate medical loan. So if anyone needs a help for that particular activity, so emergency can be for anything, and for medical exigencies, can be for travel costs, or loss of wages, anything. So we don't ask questions as far as emergency loan is concerned, and that is a small loan. It's 1,000 rupees loan. And we have a medical loan which is up to 2,000 rupees. So anything, if there is a planned activity, if anyone wants to they know that they are going to incur this much cost, or they have already incurred this cost, which is beyond what is being covered through this program. They can utilize this medical loan, subject to the regulatory guidelines that is something we need to check before giving anyone any loan.
Okay, so basically what SAS does, what the mutual does is it pays only for the hospital expenditures, and it does not cover wages, loss of wages, or transportation, or any of that. And if need be, Grameen Koota, depending on the number of loans that the person has taken, can take an emergency loan of up to 3,000 rupees, right? Okay, so the next question is, so I think that question has been answered already in terms of whether Grameen Koota gives a loan for the expenses which overshoots the fund that's available. Now, are cataract surgeries covered by this scheme?
Okay, so the government of Karnataka, at least in Karnataka I'll specify, the government of Karnataka has a program which covers both the APL and the BPL card holders, wherein any person holding either an APL card or a BPL card is eligible for free cataract surgeries at the camps organized by the government of Karnataka with lenses that come in from Germany. These are imported lenses, free of cost. So we have found initially when we started the program, as I told you, our program also had a lot of, we tweaked it a lot, brought in a lot of changes and things. Initially when we started, we covered cataract, but then we realized that there were no cataract surgeries, no patients coming in for cataract surgeries because the government had it all covered. So as of now, we do not cover cataract surgeries.
Okay. So basically, you refer them into the government system.
Yeah.
Okay.
But
now there are.
We do cover cataract surgeries. You'll also be interested to know that the premium is low because of all these factors. In Karnataka, the premium is 250 rupees and cataract is not covered. Whereas in Assam, with the premium of about 360 rupees, as I mentioned, cataract surgeries are also covered because the government does not have any cataract surgery programs in that region.
In Assam, is it 360 or 630?
360.
Okay, and that covers up to 10,000.
Yeah, that covers up to 10,000.
Okay, great. Okay, and there are just a couple more questions. Does the client pay 250 rupees in one go, or is it deducted from their loan?
No, so let me answer that. There are two ways of paying this membership amount. One is they pay by cash. So they pay at one go. At the time of registration fee, they have to pay 250 rupees per member per card. If there are going to be 4 to 5 members, then they have to, suppose there are 4 members, they have to pay 1,000 rupees upfront if they are paying by cash.
You mean 4 members in a family or 4 members in the group?
In a family.
In a family. So, okay, this is not 250, is not a family floater. It is basically individual from each family.
Correct. So, in a family, suppose there are 6 people. So, individual member of a group, if all of them want to enroll, I'm not talking about all of them in the family want to enroll, then they have to pay 6 into 50, 1,500 rupees.
Okay.
Okay, so if they cannot pay by cash, if they pay by cash, they have to pay upfront, they have to come to the branch and they have to make the payment. In case they cannot afford it, then we will give a loan of 1,500 rupees. And then they have to pay the loan in 6 months' time.
Okay, so if it's a loan, so you give an additional loan for 1,250 or so, and it will be, they pay it upfront and they have to pay back to Grameen Koota.
Yeah, correct. So we pay to SAS and then the customers will repay us in 6 months' time.
Okay, so that will be considered as a loan. Is it an interest-free loan or it has an interest on that?
Yes, it is. It has an interest. It's a 18% interest rate.
All right. Okay.
Yeah.
Okay. Now there is another question here. Do you have facility for C-section delivery? Because ANCs and postnatal care and deliveries are free and even incentivized in the government system. So do you have a package for C-sections?
Yes, we do have a package for normal deliveries as well as C-sections. There are certain conditions that have to be followed. That is, the member should have enrolled in the program for 2 years. If they are already a member in the program the previous year and they enroll this year as well, cesarean section is taken care of in the network hospitals, or if they, or even normal delivery is taken care of, or if they go to a non-network hospital which is not registered in a program, for every cesarean section they are given a fee of 8,000 rupees, 9,000 rupees, and for every normal delivery a fee of 3,500 rupees is given.
Okay, great. Now for the Sakis, what is their educational levels and what, how long is the training and what do you train them on, and do you also have refreshers?
Okay, so the Sakis are basically picked up from the microfinancing group itself, that is from Grameen Koota itself. We pass the word around in a group saying that a person, a qualified person who has passed their second PU or degree can come and attend the interview. Once they attend the interview, we see their skill in computer, the communication and things like that. And then a training of about 4 days is given in the head office, post which a training of about 15 days is given in the hospital itself, where one of the staff of the head office go there and train them with the day-to-day activities. And they are people who are able to identify the reports that have to be attached for all the 300 conditions for which there are approvals, and also have a little bit of knowledge of the computers.
Okay, mostly in terms of documentation for the clients that are coming in to identify and validate the cards and be able to collect the documentation and send it to the head office. Great.
Yeah.
Now, finally, there are a couple of other questions that have come up which I kept it to the last. One is, what has been your claims ratio?
Claims ratio in terms of number of clients getting inpatient treatment is about 45%. Claim ratio in terms of number of patients, getting outpatient treatment is 45%. In terms of number of patients getting inpatient treatment is about 6%. Claim ratio in terms of the amount collected to the amount dispersed is about 65%.
65%, that's a great claims ratio, a great loss ratio, 65%. And for running the program, do you also charge an operating expense?
Yes, the SAS Poorna Arogya Healthcare Private Limited, which has been entrusted the job of running the program, collects a nominal administrative fees. Also, a small administrative fees is paid to Grameen Koota for the whole process in terms of incentives to the workers or the Kendra managers who help in registering the program.
Who pays for this? Is this part of the 250 rupees per head that you collect?
It is billed out of the 250 rupees that we collect.
Okay, so what would be the percentage that goes towards the operating expenditure?
About 14% of the total collected premium.
Total collected money is operating. That's also pretty decent. Okay. Now, who pays the turkeys? Whose staff are they? Hospital, Grameen Koota, or SAS?
SAS. They are on the pay scale of SAS.
Pay scale of SAS. So the 14% that operating expenditure would cover that also.
Yes.
Yeah, great, great. I think you have answered most of the questions that have come up. Are there anything else that any of you would like to ask? Final questions? I think I have covered just about the one question that was not covered is, would you be willing to work with, are you only wanting to work with MFIs, or are you also open to working with other NGOs in other states?
We have a due diligence team which kind of takes care of the clients we kind of tie up with, or the organizations we tie up with. We are definitely open to working with NGOs and MFIs of other states, provided the thinking is similar to what we think, and it is not, we want to work with like-minded organizations who actually want to deliver the service to the last mile and are ready to wait for results to come. They're not too pushy as to, giving us 10 clients and then saying, okay, we need all of them to get treated, and only then we are convinced that we will give you the program and things. So we are definitely open to working with like-minded organizations, whether they are MFIs or non-MFIs.
What would be your due diligence parameters to work with an organization?
First is whether they have enough number of client base that they are working with, because what we feel is that for one hospital to be established and one hospital to be serviced, a minimum of 4,000 to 5,000 clients is required around the hospital. So that would be one of the due diligence criteria. The other one would be for them to be willing to work in tandem with us, so that we build a system that they can start running as the program goes ahead. So these would be the two basic criteria for us to start working with.
Okay. Okay. Is there? Thank you very much for that answer. Is there any other question? Does anybody else want to ask? Final chance you get to ask questions to Anshul and Arjun.
There's one final question from Deepti from PFHI. How is working in Assam different from Karnataka? And how efficient is the implementation of Grameen Koota program in both of these states?
Oh, there's a huge difference. It's been easy for us in Karnataka, basically because after having worked with Grameen Koota for about 7 years now, most of the clients recognize our hospital as Grameen Koota hospitals. So that's the kind of closeness we've had with Grameen Koota and things like that. Whereas in Assam, it was very difficult to convince the hospitals, and because none of the people know about an insurance there and things. But the factor that helped us in Assam was that we had a World Bank grant to take care of the program to meet the initial problems in the first few years, which helped us a lot as well. But working with Grameen Koota and Karnataka has been, there's a huge difference between how we started here and how we started there, but we are hoping to get there in Assam as well.
Okay, that's all the questions that remain, I believe. I apologize if we left out any questions, but we are definitely running up on time. Mukti, do you have any final words?
Yes, I think this is a great initiative. I'm sure if it comes within the, when you start scaling up, there will be other challenges also, which I'm sure that you would be overcoming. And if it is dovetailed into the existing government programs, there will be more power to the whole scheme itself. And the way you have integrated the HMO model with the microfinance and the TPA is very interesting. And I would love to see, watch and observe as to where it is going, especially in terms of the claims and in terms of the governmental regulatory framework, how this would move forward would be very interesting to watch and learn from. But on the whole, I think it's a great experiment, and I'm sure that this would be easily scaled up where you have hospitals and microfinance institutes where we can take this to. Thank you very much for participating today. And I'm sure if you have questions and if you want to implement this within your own areas, it would be, I'm sure that you can get in touch either with DSK or Anshul or Arjun to see how this can be integrated into your own activities. Thank you.
Thank you, Mukti, so much. Thank you, Dr. Arjun, and